Well, Simon Wallace is the CEO of the Aged Care Association. It represents more than 90% of the aged care residential sector, including providers of rest homes, hospital and dementia care, and he joins me now. Good evening. Why do you think that aged care nurses are paid less?
Lisa, as you've heard in that piece just now, our aged care nurses shoulder enormous responsibility, and they are leading teams of caregivers, of activity coordinators. They are providing palliative end-of-life care. They are looking after families in very difficult situations. Our aged care sector is nursing-led. It's a nursing-led profession. And for far too long, they have been undervalued. I think what we've seen with COVID-19 is the tremendous value that they've delivered in keeping our old people safe through this really difficult time.
The thing is, though, as in that statement provided, you're basically paid, well, the aged care sector basically gets bulk funding via an agreement with the DHBs, and then it's up to the providers to do the negotiations with their employees, nurses, directly. So, I mean, is it a second tier of workers, well, by the industry's own creation?
So I heard the statements that were made by the Ministry of Health and other agencies. I mean, I think that they have a responsibility to also value the role of nurses in aged care. I mean, aged care is a mainstream part of the health system. We have 40,000 beds. We are looking after very sick people and keeping them from admissions into public hospitals. We play a huge role. And they can't renege on their responsibility in terms of valuing our nurses. And that's gone on for far too long. The situation was compounded in 2018 when the government reached a settlement with public hospital nurses, and that's just seen the difference in those pay rates become even more.
So at the moment there are a number of vacancies, and with the DHB jobs being more attractive because of the pay people are getting there, I mean, how are you going to fill these positions?
Well, it's really challenging. We have around 300 or more vacancies now. We want to be able to train New Zealanders, and we're doing everything that we can to do that. The border closure means that it's much harder for us to bring our nurses in, even though that they are regarded as essential workers. There is a cap on the border in terms of how many people are coming through each day, and they are returning New Zealand residents and citizens. So it's very hard still for us to bring in nurses from overseas to fill those gaps.
So,
meantime,
Simon, sorry to interrupt.
The DHBs can keep taking our staff.
So regarding the border, are you still not getting nurses through the border at the speed and the numbers that you would like, even though they're essential workers?
Even though they're essential workers, there is a cap, 250 cap on the number of people that are coming in each day. They are largely returning New Zealand residents and citizens, and we're not getting those internationally qualified nurses in that we need to fill the gaps. Meantime, as I said, we've got the DHBs poaching our staff simply because they can pay more.
Do you know how many nurses have been turned away at the border or not been let in under the essential category?
Well, we as an association represent more than 600 rest homes, so we're in touch with our membership on a day-to-day basis. I don't have an actual a number on that, but it would certainly be in the dozens in terms of the number of nurses that we're not able to bring back into the country at the moment.
I want to move on now to this review that has been released today, and it was into the COVID clusters at rest homes. Did they need to do a review into aged care to tell you that you need a national outbreak management policy and basically a pandemic guidebook or handbook? Because those are the things you were telling this program that you needed at the beginning of March.
And I remember talking with you, Lisa, back on the 3rd of March, and the Aged Care Association called out the government, the DHBs and the Ministry for not engaging with us. So what this report does is simply reiterate the things that we were calling for then, which is a national plan, which is around access to PPE, which is around the pandemic planning. So you're right, there's nothing new in this report. But having said that, we will engage with the ministry, we will engage with the DHBs, and we'll do that from tomorrow.
So did they simply ignore your concerns and are only now, reinforcing the concerns now that their experts have brought up the same things?
Well, you know how long it took for us to get a response from the health authorities in terms of issues like PPE, for instance. And we agitated through a lot of March to get that equipment. So, I think there are learnings for all of us. I'm not saying that the rest home sector is beyond reproach. There are definitely learnings in there for us, but equally there are learnings for the public health agencies, and we actually want to be able to work with them collectively so that we're even better prepared next time. I mean, we've had 39 cases of resident infections amongst 36,000 residents. Sadly, there have been some deaths, but on the whole, the aged residential care sector has done a really good job in managing COVID in New Zealand.
So what is the principal lesson that you take away from this? Because the report does say that few facilities had fully comprehended the impact of a probable case on the facility. That's in terms of staffing, that some took too long to recognise an outbreak, and that concepts like outbreaks, clusters, probable versus proven cases was concepts that were not widely understood among some aged care facilities. Isn't that some basic stuff that you should have got right too?
Well, I think it's basic stuff that some of the public health agencies should have communicated better as well. And I think that we are a sector that is an acute health environment, and we're run by professional nurses. We have pandemic plans in place. We have plans in place for norovirus and influenza. So this is nothing new for us, Lisa.
Did you get enough help then?
It took us a huge effort. We would admit it took us a huge effort early on. We had to call the government out early. And even this report identifies the fact that health agencies had a priority on tertiary, on public hospitals first. And that shouldn't have been the case when we are a mainstream part of the health sector.
Given that the infections were found to be brought in by staff and visitors, were they preventable? Could more have been done to stop that happening?
Those things are good in hindsight. I mean, there are other ways that the infections could have been brought in through residents being admitted from public hospitals or being readmitted from public hospitals into a rest home. And the report doesn't find any fault with that. It simply identifies the vector as having been staff or visitors. And we had very strict visitor protocols. We went into lockdown very, very early in our rest homes before the rest of the country does.
Appreciate your time this evening. That's Simon Wallace, who is the CEO of the Aged Care Association.